Pipetting is an integral part of performing many microbiology tests, especially for molecular testing. The volumes pipetted can be very small, so a micropipette is often used. Micropipettes are used to pipette volumes less than 1 milliliter and can go as low as a tenth of a microliter. The smaller the volume, the more important and difficult it is to accurately pipette. Here is an example of a micropipette. At the top is the plunger, which controls the airflow in and out of the pipette by pushing the plunger down to one of two stops. The plunger is also typically where the volume is adjusted. The tip ejector button controls the tip ejector mechanism below the body of the pipette, which discards the tip after use. There are two main ways to pipette: forward and reverse pipetting. Forward pipetting involves drawing up the exact volume of sample needed, is used when pipetting aqueous solutions, and is the method most commonly used in the clinical laboratory. In this technique, the sample is drawn up using the first stop and dispensed using the second stop. Reverse pipetting involves pipetting slightly more sample than needed and is used when pipetting viscous solutions. In this case, the sample is drawn up using the second stop and dispensed using the first stop. Let's look at both pipetting techniques, starting with forward pipetting. After attaching a filter tip to the bottom of the pipette, push the plunger into the first stop. Holding the pipette vertically, lower the tip into the sample. Be careful not to move the plunger or create bubbles. Slowly release the plunger to draw the sample into the tip. The sample is dispensed by pushing the plunger down to the second stop. In reverse pipetting, the plunger is pushed to the second stop. Holding the pipette vertically, lower the tip into the sample and slowly release the plunger to draw up the sample. By pushing the plunger into the second stop, slightly more volume than needed is drawn up into the tip. The sample is dispensed by pushing down the plunger to the first stop only. Be careful not to push down to the second stop, as this will dispense more volume than needed.